Perfect. But yeah, that's super exciting. At least did quarantine, like you got to spend some time with the baby.
Weird time to have a kid. Actually, my sister-in-law had a baby while all this was going on, so like they didn't let anyone in the hospital.
Wow.
They were just on lockdowns. We're like, all right, well, we didn't have that. So
wow. Oh my goodness.
but they were like, all right, no one can come in. You're on your own. It's like,
wow,
stay here a bit and then you go. So
oh my goodness. Yeah, I can't even imagine that. I think your volume is going in and out a little bit, John.
Yeah, it's kind of cutting a little bit.
I was gonna say I could probably do headphones.
Yeah, that usually helps. That's why I have mine in. But I mean, it's not terrible, but
Let me see.
headphones might help. Oh, we had somebody already write in the Q&A saying, hello, everyone.
Hello.
hello.
Hello, Angela. I love that.
Yeah, all right. Is that better or is that?
I think that's better so far.
Sounds better.
Okay.
Yeah.
Cool.
Perfect. And yeah, like I said, we'll start in like 1 minute here.
Chris, how's everything over at Levine?
It's going really well. Well. A lot busier from when we started back full steam. We're pretty excited.
Yeah, that's cool.
Levine, that is out there a little bit.
It is, and I live on the other side of the city too. I'm more northwest side, so
that's
quite the drive.
How long's your commute?
About 40 minutes on a good day. Not too bad though.
Yeah, that's the same with me. So
yeah, at least right now there's like limited traffic.
No traffic, yeah.
So that's nice.
It's like that's hugely helpful.
Oh yeah.
That's gonna change. So
I know, I'm like enjoying it while I can.
Mm-hmm.
You just gotta look at the bright side.
Gotta look at the bright side.
Okay. Oh, sorry, go on.
No, go for it. Becky, you said you're at Arcadia now?
Yes. Yeah.
Okay, cool.
Yeah.
Okay, I was just gonna say, let's take like a quick 15-second pause and then we will go live here, so. All right, it is just after 7 o'clock, everybody. So I think we are gonna go ahead and get this thing started. Thank you all for joining us and for logging in this evening. My name is Brenna Leftwich. For those of you who do not know me, I am an academic and industry relations manager for Aspen Dental Management, Inc., also known as ADMI. We are the company that supports our Aspen dental practices. I've been with Aspen for about 2.5 years now. I work with dental schools and dental hygiene schools from the West Coast to the Midwest, so covering a lot of ground there, but I love it. I have 3 lovely panelists joining us tonight. I will have them introduce themselves in just a moment here. I just want to let you all know that I have all the questions that you guys have submitted in advance. They were great questions. I have them over here on my second screen. So if you see me looking over here to the right, I swear I'm paying attention. I don't have anything more exciting going on over here. But so I will be reading those, and there were some duplicates, just kind of lumped those together, but I just want to let you know we'll do our best to get through everything and answer those as honestly as best that we can. There's also a live Q&A button, so if you guys have any follow-up questions or anything you come up with on the spot, we will be happy to answer those. You can also submit them anonymously. I think that Q&A is right at the bottom of your screen if you haven't seen that. So with that being said, that's about all I have. I will let our panelists introduce themselves. Becky, would you like to go first?
Sure. Hello, my name is Becky. I have been with Aspen for about 3 years now. I've held a couple different positions as a clinical dental hygienist. I started out as a float hygienist, traveling throughout the valley to all the different locations. Then I am now the lead hygienist for an office in Phoenix.
Awesome. And Chris, would you like to go?
Hello, everybody. My name's Chris. I have been with Aspen since October of last year. I'm the lead hygienist at the Levine office location, and we're a pretty new office. We started out in November, so that was a pretty exciting event. We got to open up a whole new office, knew everything, and got to experience that. So it's been a lot of fun so far.
Very nice. And Dr. Vayon, what about you?
I'm Dr. V. I graduated from dental school 2017, so I've been with Aspen for about 2 years. Started off as an associate, and then I'm now the MCD, the managing clinical dentist, which is a fancy way of saying the lead dentist over at the office in Mesa Riverview. So that's where I'm at.
Awesome. Well, thank you guys. We are all very, very happy that you're joining us. As you guys can see, we have 2 hygienists and a doctor on, so definitely getting all aspects of being in an Aspen dental practice. We're very excited, and these are all great resources for all of you students out there to reach out to if you have any questions after this. I'm sure they would all be happy to help out. Like I said before, this is an Ask Me Anything session, so literally ask anything, the easy questions, the hard questions. That's what we're here for, and we will give you our best and honest answers. So with that being said, I think I will go ahead and get started with some of the questions that you guys submitted in advance. And like I said, if you have any follow-up questions, please feel free to throw them in the live Q&A session. So we're going to start off here with a nice broad question. Why did you choose Aspen Dental? So did you start with Aspen Dental? Have you worked for another DSO, private practice? And if you did start with Aspen, did you look elsewhere? So I think you all can touch on this a little bit. Dr. Vayon, would you like to start first?
Yeah, so I actually did not start with Aspen Dental. So I worked for a company it was a private company that worked out on the Navajo reservation. So it was a lot of public health, just a very unique environment that I was working in. I ultimately came to Aspen to gain a little more experience in some of the fields that interested me more. So ended up moving to Phoenix, and had the opportunity to kind of wet my feet and dabble in some areas that I wasn't getting exposure in over with the public health job. So that was kind of my motivation for coming on board.
Mm-hmm. Well, great. Yeah, so you definitely have some experience outside of working with Aspen Dental, which I think is great. Provides a little bit of a different perspective when you've done a little bit different types of dentistry. So I think that's awesome. And what about you, Chris? Would you like to tell your experience a little bit?
Yeah, so Aspen Dental, they actually, when I was a student at Carrington College in Mesa, they came and did a presentation, and everything that they presented, it really stuck with me. I mean, I had tons of questions. They answered all my questions fully, so I always kept Aspen Dental in the back of my mind for a possible place to practice hygiene. And so I didn't start out there. I wanted to gain some experience, so I did a lot of temping with some temp services. Gained a lot of experience and knowledge, kind of saw the ins and outs of hygiene. And then I figured, you know what, it's time to perfect my craft and give Aspen a chance. And they actually gave me a chance. And it's been great for my career so far. I couldn't be happier with it.
Awesome. Well, I do a lot of those presentations, so it's definitely good to know they've had an impact on somebody.
Big impact, yes.
Awesome. And what about you, Becky?
So I've been a hygienist for about 7 years, and I started out, I've worked in other DSOs. I've also worked in private practice, and I temped for a little while as well. I decided to join Aspen because I was ready to be with a company that I could move up and advance my career. I also, having a husband who's a veteran, family members who are veterans, I saw on TV how Aspen has what's called a day of service, where we really get a chance to give back to the community, give back to the veterans. We offer free dental care. They also have a mobile mouth mobile where they travel throughout the country. I was able to take advantage of that and be a part of it in November, and they're a fantastic company. So I love my career with them so far.
Yeah, that's awesome. I love that you brought up the day of service and the mouth mobile, because those are two things that I thought were pretty awesome when I first started working with the company. So here we have another question. So I guess this is for our hygienist. From a hygiene perspective, what have you found is the biggest benefit of working for a DSO? And just for those of you who don't know, a DSO stands for a dental service organization or dental support organization. And basically it is the company that supports the dental practice from everything in the office, basically from a non-clinical perspective. So all the business aspects of running a practice. So you'll hear me say DSO probably quite a bit, just give you an overview of what that is. But so again, do you hygienists want to touch on the biggest benefit of working for a DSO? Would you like to go, Chris?
Yeah, absolutely. So working as a temp hygienist, I got to work in private practices as well. So I got to see, the world of private practice. There's pros and cons to each one, but the biggest benefit of working for a DSO is just the support that you have from so many different experts who've been in the field for so long. If you ever have a question that you cannot find the answer to, odds are that you're going to be able to contact somebody, within your office or your district that will have that answer. So just the full support of everything you need to be successful in your career is right there at your fingertips.
Mm-hmm. Yeah, I mean, I guess that kind of goes with the DSO name, the Dental Support Organization. So
right there in the name, yep.
Yes. And what about you, Becky? Anything to add on to that?
Yeah, I mean, along with what Chris said, we just have some excellent clinical support as hygienists. We're also able to, which I really love, manage our own business as far as doing our own ordering for our patients, really being able to forecast our patients' needs and be able to meet those needs. Also, when I was a float hygienist, I did develop a lot of relationships with doctors and hygienists in the region, and I will say that they are all very impressive. Aspen hires some very, very, very good doctors and clinicians, and they all have the patients, giving them the best standard of care possible. They're just some really, really good clinicians that I have a lot of respect for. So you'll definitely, if you work with Aspen, just, you'll have a lot of good people around you and a lot of good support.
That sounds like a shout out to you, Dr. V.
Absolutely.
Yeah, I'm hearing a lot of this, a lot of the same stuff that they're touching on. DSOs provide for hygiene is, some of the same stuff that we get as doctors, right? So the support is just really there. You have the ability to just focus on mastering your craft and becoming, a better clinician when you don't have to worry about some of the other aspects, the other details. So that's just very important to development, and especially as a new doctor, it's incredibly helpful.
Mm-hmm. Yeah, no, that's great. I was just basically going to ask you a doctor perspective, but I think you just covered that as well. So that leads us into our next question, which is actually one of my favorite questions I get during Lunch and Learns, because I think it's the best kind of misconception of Aspen Dental. Do you guys have quotas that you need to meet within the office? And I think all of you can kind of touch on this. Do you want to start, Dr. Van?
Yeah, I'll start it off. So we don't have quotas. So you pretty much have full autonomy to do, the procedures that you want, to treatment plan how you want. So there's really nothing to say, all right, you've got to do X amount of fillings, X amount of crowns, X amount of extractions, whatever it is. So, it's one of the things that I've, really enjoyed, is just having the ability to do your work, right, and practice the way you want to. So in a nutshell, no, we don't have quotas.
Mm-hmm. What about you guys? Becky, do you want to take that one?
Yeah, I mean, I will say that as far as like support from the non-clinical staff, they will, definitely help you to support your business, but we ultimately believe in doing the best thing by the patients. And when you're doing that, we believe that the numbers and all of that is going to follow.
Mm-hmm. That's a great answer. Chris, do you have anything to add?
To follow up what Becky said, exactly. She said just perfect. You do right by your patients, and of course, everything else will follow. So we have that autonomy to really prescribe and treatment plan what we feel is necessary for our patients. And we just do that as we see fit. Everything else will follow.
Great. Yeah. Thank you for that answer. I do love when people ask that question because I do think it's definitely on people's minds. So I definitely like to kind of provide them with an actual answer from three clinicians that firsthand work in the practice and can say, no, you don't have quotas. So thank you for that answer. And that definitely leads into the next one with what is the clinical autonomy like in the office? And that can be both as a dentist and as a hygienist. So again, Dr. Van, do you want to talk about the clinical autonomy in your practice?
So like I mentioned before, you really have brains in there, right? So, that's kind of one of the things that going into, I mentioned before, it's the experience that you get at Aspen that really drew me. And I've had the opportunity to just dive into so many different aspects, right? So, if endo's your thing, you can do endo. If you like extractions, you do extractions. So it's really up to you. And, as you further yourself in your career, you'll get a knack for what you like and, the type of procedures that you appreciate, right? So, and you just have full chance to do whatever you want.
Great, thank you. And what about you, Chris? What's the clinical autonomy like as a hygienist?
Full autonomy as a hygienist. I mean, our non-clinical directors, even the dentists that I work closely with, every dentist that I've worked closely with in Aspen, they really believe in what we do for our patients. There's no undermining anything like that. They really take what we diagnose and what we see will help our patients. They really take that to heart. So they really trust, our professional expertise on that. And I mean, treatment planning wise, full autonomy of what procedures they might need, but we just have that full support. So that's what I really like about Aspen is there's really no nonsense. There's those professional agreements between doctor, hygienist, office manager. So we're able to really work on our patients very well.
Yeah, that's great. And do you have anything to add on to that, Becky?
No, I agree completely. My doctor and I trust and support each other. And obviously as a hygienist, I can't diagnose, but we have a really good working relationship. So.
Great. And I had a live question submitted here, just asking where I can find jobs on maybe the Aspen website. And I did want to answer that really quick. One, you can go on our website, aspendentaljobs.com, and look things up. Or I will definitely send an email out to everyone who's registered on here and follow up with you guys, and we can chat, and I can go over all of the open positions and chat with you in a separate setting to go over some of that. So I just wanted to answer that question, and that will move us on to here we have how many dental assistants work in your office. And I think each of you are in different practices, so that could kind of answer that quite a bit. Becky, how many dental assistants are in your practice? And do you have any as a hygienist?
So we just recently added a second doctor. So we have, similar to what Dr. Bayonne is, a managing clinical doctor, and then now we also have an associate doctor. And so each of those dentists have 2 assistants that help with their procedures, and then we also have an assistant that helps as far as new patient exams, taking the FMX, doing all the charting, doing, following through with the exam with that new patient. I personally don't have any assistants because I get as much time as I need for my procedures. We schedule at least an hour for our recall patients, and then at least an hour and a half per half mouth for our SRPs. To follow up with that though, our team works great together. We do work at a higher pace, so we really, we do a good job working together. If I'm, going in to see a new patient, my dental assistants have no problem flipping my rooms, and vice versa. I help them do sterile and help them catch up when they're running behind as well. So it's really about the teamwork, and that's what really keeps everything going. And the patients notice. They're always commenting about, how happy our team is, and we really are. We love working together.
Awesome. Well, I love that. Chris, do you have anything to add?
Pretty much the same thing as Becky. So in my office, we do have one doctor, but we have 3 assistants. I personally don't have an assistant either, but the same thing that Becky said, just the teamwork, just the hustle of all the assistants. They're picking up anything where I might be lacking, whether it be flipping rooms and vice versa. I'm always helping them with sterilization. It's just that mutual agreement, like, hey, let's get through this. Sometimes it'll get busy. Sometimes it's slower. Any day can change, but just working with those assistants, because I know they make that office run smoothly. So always treat your assistants good.
Yes, the assistants are vital.
Yes, that's a great motto. Dr. V, what about you?
Yeah, so in our office, we have 3. So there's one doctor where I'm at, and we have 3 of them, a lead, and then 2 others. But it'll vary from office to office. So you've got some practices that are much bigger and see more patients that might have 4 or 5 assistants. So it just varies depending on the office. But I think Chris kind of did. They're just key to keeping the flow and keeping everything running smoothly. Because in the end, they intake the patients. They're kind of the battery back. Behind the front desk. So, in our office 3, but that'll change depending on where you are.
Yeah, I think Dr. V brings up a great point. So it definitely depends on the office that you're in and the patient flow. So just kind of a fun fact. So all of our offices are actually individually owned by doctors. So Aspen Dental Management, the company I work for, does not own the practice. You guys do as doctors. So all of these things are going to depend and change a little bit depending on the office and the practice that you are in. And we did have another live question here, and I love this one. It was, do you have team building activities? I really like offices and coworkers that feel like family. I love that question. I feel you guys are all smiling. Dr. Reed, do you want to answer this one first?
Yeah, no, we definitely do team building activities, and that's what the office, that's the feel in the office, right? We got 9 people in there that work tightly and have to work together on a daily basis. So every now and then there's friendly competition between the offices. So we'll do stuff like that with prizes and things to be won. We've done escape rooms and things of that nature, but we try to do stuff together, regularly, just to lighten things up and again, just strengthen the relationship between the team. So
I think everyone wants to know, did you make it out of the escape room?
we did that time. We absolutely did. So it wasn't even we didn't even sweat.
Awesome. And what about you guys? Becky, you want to go?
So if I can brag on my team a little bit, every October for National Dental Hygiene Month, we will do an Oral-B test drive program. Basically, we believe in Oral-Bs at Aspen Dental, and so we'll, have a competition where we try to get all of our new patients, recall patients, to test drive the Oral-B. And every week they draw out of an office, and my office actually won, and Aspen gave us $700. So we went to main event and we did bowling and laser tag, and they have like a zip line thing that was terrifying. So it was a lot of fun. We had fun with that.
Oh, that's awesome. What about you, Chris?
Same out in Levine. We're a pretty competitive bunch out there. So anytime there's an internal office contest, we're on it. So that really helps with the teamwork. Just the chemistry in the office as well. Team building also. Just seeing our coworkers outside of that professional setting, I feel it helps a lot with all that chemistry.
Yeah, and I mean, I feel like one of the questions I get with my job a lot is always about culture within the practice. And when people ask, like, how do you kind of differentiate between Aspen Dental and other DSOs, culture is kind of always one of the things that I bring up, because I do find that to just be like unparalleled within our practices and within the company as a whole. We do a lot of fun, like company competitions like you brought up, or just company like leadership retreats. We have vibe sessions, like all these fun things that doctors and hygienists and everyone within our company can take part in. So I think that's pretty great, and it seems like you all agree as well.
Oh yeah.
Yeah.
And we have another great live question here that was, what are the CE opportunities like with Aspen Dental? And I know we have so many. Do you guys want to touch on that? Chris, you want to start?
Yeah, I mean, all the opportunities for CEs are at your fingertips. There's so many resources to use at Aspen Dental, whether it be online, in person, sometimes traveling for some CEs. There's so many opportunities for it. And the best thing about it, a lot of them free of charge. So it just takes your time, and very, very worth it to take advantage of those opportunities.
Yeah, everybody loves free.
Absolutely.
Yeah, and Becky, do you have anything to add from a hygiene perspective with CE?
Like Chris said, it's great because we have a specific section of our Aspen intranet where you can always log in and do CEs on your free time. And yeah, and then we also partner with our different vendors and do lunch and learns and things like that too with our reps.
Mm-hmm. That's awesome. And Dr. Van, what about you?
Yeah, so I'll say that's one of the biggest things. So you can find CE on any, right? So if you are interested in it, there's probably a CE out there that's available, through Aspen. Recently, we're in one that I've done recently is an implant. So it's this extensive course on, restorations of implants, how they apply to us and stuff like that. So that's probably the last one I've done, but I've done training, related to ortho and clear liners, crown and bridge, just dental management. So there really is a good amount of information to us on just a very wide range of topics.
Yeah, definitely. So I do know that's a huge benefit to working for a large organization, is the CE opportunities. I'm sure you guys get emails about them all the time.
Yeah, and it's changed a little bit, right? Because in the past we'd be able to congregate as groups and attend some live stuff, but even though the environment's changed, a lot of that stuff is available like we're doing now through Zoom and just virtually. So
yeah, I actually think we're offering free CE through December, like to students and all of that, which I will send the link out for all of you guys if you want to do that. If you're interested, I'll send the link out to everyone that's registered to your guys' emails that are on here. So be on the lookout for that when this is done, because I do know that's huge for you guys to kind of stay up to date and get the free CE. But again, like with companies, we have partnerships with, I'm trying to think, like Nobel and Henry Schein, that help us put on these CE courses. So that's just, again, a benefit to working for an organization that you can't really get in a private practice setting.
Yeah.
So we have another live question here that says, can an RDH buy into the practice? To my knowledge, I don't believe so. Our hygienists, I don't believe that's an option.
I don't believe it's an option just yet. Yeah. I know they're getting more information on it, but it's still pretty alpha right now, so not too much information about that.
Yeah, I mean, right now, like I said, our practices are 100% owned and operated by doctors. And that is, I mean, they have great relationships with our hygienists and they work hand in hand. I think everybody knows hygienists are part of the backbone of a practice. And I think Dr. V would agree to that. But I do not believe there are ownership opportunities for a hygienist. And that kind of leads into our next question again. So how does the treatment planning go in the offices between the dentist and the hygienist? So can you kind of elaborate on the relationship that you each have with, our hygienists have with their doctors, and Dr. Mann that you have with your hygienists? So Dr. B, do you want to start?
Absolutely. So we kind of mentioned earlier, the office being like a family, and everyone's got to work really well together. So the relationships between whether it's the lab technician, the hygienist, the assistants is pretty tight. And so when we're creating this, we're creating an experience for the patient when they first see us, we want them to meet the team. So the hygienist goes in there, the doctor's in there, the assistants are very involved. And in my office, since we do work so closely, my hygienists are very just similar in how we treatment plan things, right? So we've taken time out of work and when we're not with patients just to get on the same page to create this consistent experience with the patients. So we know each other's style and things like that, and we work together to create a comprehensive plan for everyone. So in the end, we're pretty tight.
Mm-hmm. And Becky, what about you?
I agree with what Dr. Bayonne said. My doctors and I are similar, and part of a hygienist's job is to know your doctor, and I know my doctors. And so when I go into the new patient exams, or I have my periodic exams, if I see things that my doctor I know is going to diagnose, I'm setting the doctor up for for that conversation. Oh, I see that you have a fracture, an amalgam, and kind of go into what causes the fracture. They're probably going to put a crown or something on on that area. So and my doctors do similar. They know kind of how I like to treatment plan my hygiene patients, and they'll do the same thing. After I talk to them about why they need SRPs, my doctor will come in and oh, it looks like you have some gum disease going on, and kind of touch a little bit on it as well. So we work together. We're a team, and we definitely play off of each other to really give those patients the care.
Mm-hmm. Do you have anything to add, Chris?
Becky and Dr. V, they touched on all the good points. That hygienist and doctor relationship, just kind of knowing how each other's treatment plan will go. Like Becky mentioned, if I see something on a recall patient, I know doctor is going to want to look at and examine. I'll discuss it with him, and vice versa. If he sees some active periodontal disease going on, he's going to bring me into the room, talk to the patient about it together, and we just kind of feed off of each other like that.
Mm-hmm. Well, great. And we did have another live question, and that actually kind of ties into one that we have here for hygienists. And this one is, how much time do you have, or do you get for a patient? So I think, do you guys get to pick that, or does somebody else make your schedule? And then do you guys have your own room as well? So do our hygienists, Chris, do you want to take that one?
Yeah, so most locations in Aspen are set up pretty much the same. I'm in a newer office, so I do have my own actual office. It makes it nice, more private conversations with my patients. And then I totally forgot the beginning of the other question.
Oh,
so we do have our own offices.
Yeah, so you have your own room, your own hygiene column. Yeah. And then how much time do you get for a patient? Is that something that you get to pick, or?
Absolutely. So pretty standard, an hour per recall patient, depending on, what type of diagnosis they have, at least an hour and a half per half mouth SRP. If it's a, certain situation where I know there's some tenacious calculus, I know it's going to take a little bit longer, I want to take some post-op x-rays, I just always communicate with either my doctor or my front office staff that, hey, I'm going to need a little extra time for this. They schedule accordingly as well. So you have a lot of control over your schedule and how long you'll be able to see your patients.
Mm-hmm. And so is that kind of what you have to say, Becky? Do you agree with that?
Yeah, absolutely. I would say too, with COVID, Aspen's been great about giving me 15-minute increments, 20-minute increments in between my patients, so that we're really able to even thoroughly sanitize and make sure that we're disinfecting properly to keep all the patients safe.
Yeah, and we definitely did have a lot of COVID questions submitted. So I just want to let you guys know that I grouped kind of all of them together, and we'll kind of save the last like 10 minutes or so to get all the COVID and the PPE stuff, just to keep it organized. I lumped all those together. But while we're on this topic, Dr. Bayon, do you make your own schedule, or how does that work?
Absolutely. So I was going to say my hygienist does the same thing, right? So depending on the case, right, each case is different. So not every prophy is the same. Some SRPs are more complicated. So, you know, she's involved in creating, you know, the times and timeframes that she needs. And then just getting off that, it's the same with us. So, you know, not every occlusal filling is the same. Not every, you know, extraction is the same. So when you put that into it, some are going to take more time than others. And, you know, we fit a group of procedures into a day of work. So we pick our own times, you know, whether fillings, extractions, crowns, all that stuff. One's telling us you've got to do it in X amount. It's whatever you need to do to get the job done.
Awesome. Thank you. Yeah, I would agree with that as well. And another question that we have that I think is a pretty good one is, can you tell us what your average day-to-day is like in the office? So I think, can you kind of go over like the hours, like what time you show up, when you leave usually, typically how many patients would you see, and what are the, I guess, common procedures that you would do? And I guess you all can take that. Dr. Van, do you want to start?
Yeah, so we have different days. You know, we have a late day every week to be available for patients. And then we have a half day on Fridays. So in total, I want to say it's like 40 hours that we're available, but it's 7:30 to 5:30 on a, let's call it a normal day. And then our late day would be about an hour and a half later, so 9 to 7. And then Saturdays at half day is 8 to 1. We've got Saturdays open on occasion, you know, for a half day, 8 to 1. And the flow of every day is, you know, kind of follows the same schedule. So we get together before the office opens. We have a daily huddle. We go over, you know, the plan for the day and how we're going to attack it. And then we work seeing, you know, the patients up to lunchtime. You know, we break for an hour and then finish off the end of the day. So depending on volume, you know, there can be a wide range of new patients that come in, but generally you're working a production column, a new patient column, overflow column, and I want to say you're maybe seeing 20 to 30 patients in a day.
Okay, and that's as a doctor?
Yep.
Yes. Okay, great. And so hygiene, you want to talk about the hours that you guys are working a little bit? Becky, you want to start?
Sure. So I work similar hours. We get an hour for, you know, as a standard, we get an hour for our recare patients and then an hour and a half for our SRP. So it just kind of depends on what we have scheduled. I do typically do at least one, sometimes 3 SRPs a day, just kind of depending. We're also really big on providing same day care for our high infection patients. So if we have a new patient that has active periodontal disease or is in pain, you know, in a certain area, we're trying to get that patient out of pain. We're trying to treat their periodontal disease. As a hygienist, the last thing I want to do is spend, you know, 5-10 minutes educating a new patient about their active infection and then say, okay, we'll see you in 3 months. That doesn't do anything. So we are definitely trying to however we can, you know, start some of those high infection patients as well.
Awesome. Yeah. And so I do know a lot of people logged in here are students or new grads, and you kind of keep talking about the time, saying you have an hour, like an hour and a half. I think something for students and people fresh out of school, I think time is something that might stress them out a little bit. I don't know if you guys can relate to that when you came out.
Yeah.
Can you just talk about that a little bit? I mean, just being flexible and allowing students the the time that they need, especially when they're fresh out of school. So Chris, do you want to talk about that a little bit?
Yeah, absolutely. So I remember that new hygienist anxiety. It's a real thing. So allowing yourself enough time. I mean, you get the proper training. You get to understand the flow of the office before you're basically released into the wild. And like we mentioned before, you really do have control over your schedule. So if you need a little bit more time, you're the clinician. You're allowed to take a little bit of extra time just to make sure you're doing a thorough, job for your patient. So we always do right by our patients. So with time and experience, you're going to be able to fine tune your craft a little bit better, timing wise, time management. We keep saying that word time, but as time goes on, you will get better at it. So it's a delicate dance basically, but everybody learns it.
Would you agree with that, Doctor?
Yeah, so it's like a totally different world once you're out of school, right? Because you're the person that makes the decision. You don't have to go to someone for a start check, for a prep check, for a restorative check. It's all on you. So I think a lot of times, as a new grad, come out and you this feeling of just unpreparedness. You just have to have confidence that everything you've done for the last 4 years has prepared you for this. So you give your time initially based on how you think things are going to go, but you get quicker the more you do it, right? So with repetition, you master your craft, and you'll start off giving yourself a pretty good chunk of time for everything, whether it's a filling, an extraction. And the more repetitions you get from doing it, you're going to see your time shorten. But ultimately, you decide what those times are. If it takes you, 30 minutes for a filling, then you give yourself 30 minutes. And over time, that'll improve and you'll see those shorten. But you're the one that gets to select that.
Yeah, and I mean, we'll definitely talk more about new grads in our mentorship program for both hygiene and doctors here in a minute. But while we're kind of talking about time and hours, we had a couple live questions. One was, are there part-time hygiene positions? And another one was, do you guys close on holidays? Becky, do you want to answer that?
Sure. As far as part-time hygiene positions, I know that they do like to have full-time hygienists. That would kind of be up to, the individual manager and the doctor as far as what they wanted to do with that. But typically I know that our hygienists are full-time. Like Dr. Bayonne said, though, that on Fridays we work half days. So it's full-time, but there is definitely some flexibility as well within your schedule. So yeah, I would definitely say that. And also just to kind of go back a little bit to the training, I know we're going to touch on that a little bit more, but as a new grad, it is very, scary seeing your first patient. You're going to have a, seasoned hygienist or doctor with you for a long time. So, you're going to be, as a clinician, doing the clinical work, but there's going to be somebody there to help you through every single step of the process. And it's fantastic. Aspen really, really has a very thorough training program, and you will feel over prepared coming out of their program as a new hygienist.
Awesome. Do you have anything to add, Chris, about, part-time or closed on holidays?
So every major holiday, absolutely. Yeah. Try finding a hygienist or a doctor that's going to work on a major holiday. It's not going to happen. And as far as part-time, like Becky touched on, we do have that half day, so some flexibility. All of our non-clinical staff, they understand we do have personal lives as well, families too. So very, very flexible at times as well.
Yeah, and I know there's from the management side a little bit of a running joke saying there's like 1.5 hygienists in each office. I know a lot of times there's one hygienist and like one part-time hygienist, and again it's one of those that depends on the office, but there are definitely part-time opportunities if that's what you're looking for. And we do have a couple more live questions to catch up on. This one is definitely more clinically speaking. I'm kind of nervous I'm going to mispronounce this. It's are ultrasonics or piezos used? Yes? Is
Ultrasonics.
that okay.
Yeah.
Is that a hygiene question?
It is. Yes.
Okay.
So the Cavitron, everybody loves the Cavitron.
Okay.
So most offices will use the Cavitron. Great instrument. I live by it. I don't know how anybody's ever worked without it, but yes, we do use the Cavitrons at our offices.
Becky, do you have anything to add?
No, yeah, we use the Cavitron. It's one of my favorite tools. So yeah.
Awesome. And while we're on the topic of equipment and instruments, do you guys get to pick what equipment that you use or what's in the office, or kind of how does that work with the supplies? And I think Dr. Van, you can answer this one too, but
Yeah.
Becky, do you want to start?
Sure. So every hygienist does have a budget every month. So we do our own ordering, as I mentioned before, according to the demands of the business. Along with that, we're also able to order new ultrasonic inserts, any instruments that we need. And Aspen's fantastic about really supporting you. If you need it and you need it for your patient, they're not going to say no. So yeah, you're definitely able to choose what you like.
And Dr. Van, do you have anything to add from a doctor perspective?
Yeah, so you pretty much get to choose what you use, right? Becky mentioned there's a budget, for supplies, but if there's a brand of something you like, if there's a specific tool or handpiece or something like that you use, then it's absolutely attainable. And that's one thing, just with so many offices, we have just a broad relationship with suppliers out there. So, there's probably not much that we can't get. So if it's, a restorative tool, an extraction tool, and you like it and that's what you prefer to use, you can get it.
Do you have anything to add, Chris?
They pretty much summed everything up. So you need something and it's going to better you as a clinician and as a practice, absolutely is obtainable.
Yeah, I mean, that definitely ties into what I brought up earlier with being part of a large organization. We have partnerships with big companies like Henry Schein, and that's where we can get a lot of our supplies from. And when you get them in bulk, obviously you get them at a little bit of a lesser cost. So a lot of our clinicians do use that, but again, you have the opportunity and ability to use whatever it is that you want to use. And you will be able to get in the office what you want. The ultimate goal is to provide the best care for the patient, and however you're going to be able to do that is what from the management side we're going to provide for you. So if you guys all agree with that, that was kind of my perspective on it. Let me see here. We have some more live questions. Okay, talking a little bit about payment here. Can you guys go over the pay structure? We'll do hygiene first. So Chris, do you want to talk about the pay structure of a hygienist?
Absolutely. It's very competitive with most student hygienists. They do their research, so they know what new hygienists will make. So it's very competitive, Aspen is, with other practices. So you do have a guaranteed base income, so hourly. And there's also the opportunity for monthly incentive bonuses too, based on whether it be production, performance. So you working in that hygiene business, you have that guaranteed income, but you can also better that by production as well.
Is that the same with you, Becky?
Yep.
Yeah, and then Dr. Van, do you want to touch on the payment structure of a doctor a little bit?
Yeah, so pretty similar. So it's really nice to have a base, right? Because there are certain places where you were just paid on production. So if there's no traffic in the office, or if you're just not able to get the patients in, then you aren't going to produce as much. So you've got that safety net, we'll say, where you're not going to make lower than the guarantee, but at the same time, you have opportunities to make more with the profitability of the office, and there's some incentives if your office is doing well. So you've got that safety net, but then there's room to make more.
Yes, definitely. So I think the way I always explain it when I go to any, lunch and learns, whether it be with hygiene or the doctor's side, there's always a guarantee. So you're never going to make less, but you can always make more with the incentives. And I think the big thing to point out with hygiene too is the hours are guaranteed. So if there's nothing for you to do in the office, they're not just going to send you home, and you're not missing out on anything that you were expecting. But I do know with some DSOs, you will hear that, like if you don't produce a certain amount, money will be taken away, and that's not the case. You have that daily guarantee whether you see one patient or whether you see 100 patients. So I think that definitely provides a nice kind of safety net within the office, but you still have the incentive to do more. And I think that is something that is pretty, I guess, standard in all of our offices. There's one question I wanted to get to in here. This one. So we have someone, their father owns a private practice, but if they work for him, they're worried they won't be able to see enough patients. So one that says, do you guys hire new grads? And as a new grad and a new employee, what would my schedule look like? So I think if you want to touch on like seeing patients as a new grad, like how many you'll see and just kind of what to expect coming out of school. Do you want to start, Dr. Van?
Yeah, so there's a couple things to go over here. So when you start, you're not going to, obviously being a new clinician, you're not going to be able to, see a high volume of patients, but you'll get there, right? So as you become a better clinician, then you'll become more efficient just working, and you'll get more experience that way. That's one of the biggest things I would hear from my classmates is they'd get hired at these smaller private practices where, the doctor's bringing them on, and maybe they brought them on a little prematurely where, they're keeping the bulk of the patients and there's not enough to go to the associate. And then at the same time, you're getting some of those bigger procedures that the doctor is keeping, and they're not getting the experience of some of the, the more involved stuff. So initially, you're going to follow this training program until you get comfortable. And the great thing that Aspen offers is mentorship. So you get to work with other doctors, right? So in my case, I had a very close relationship with the owner doctor of my office, who was able to really guide me through many procedures. And I don't want to say he was a crutch for me, but I knew that he was going to be there to help out if I got in trouble. So there was, it gave me the confidence to push myself and be better because I knew I could rely on that extra help. And with that, I just got better and better. So I think that's probably the progression you'll see as a new grad. You'll come on board, you'll go through some of the training, getting to know just the company, how that works. You'll get your feet wet, and then you'll get into procedures. So with the mentorship, you'll have the confidence to do what you need to, and to become a better clinician.
Mm-hmm. Chris, what about you? What is the onboarding and training like for a hygienist?
Dr. V, kind of the same thing. So you're always going to have an experienced hygienist who knows the practice, who knows the flow of the office, training you for at least 2 weeks. So you get the whole onboarding process, learning the system first, and then getting comfortable with the flow of the office. That lead hygienist will make sure that you're, confident enough, and that they're confident enough in you to start slowly seeing patients, slowly taking over their schedule, so you're eased right in. You're not just thrown right in. So being a new hygienist, everybody has anxiety, new doctor as well. So that does help alleviate some of that stress, because it can be overwhelming at times. But with the proper training that we have in place, we set up all of our clinicians for success.
Becky, anything from you?
Yeah, I'll say similar what Chris said. As a new hygienist, the first couple of weeks that you're doing your training, you're really focused on just honing in on those clinical skills. We're always there with you to support you in whatever ways you need. After that, Aspen also has something which is great that I've never seen in another company. It's where you actually go about 4 months later to another like hygiene training for a couple of days, and from there they teach you the business side of it and how to really, grow within the company. They ask you what your career goals are, and they help you kind of to progress in the company and to really be able to grow your business and also yourself.
Yeah, I think that that's really great. I know they have that on the doctor side as well, but we do love to hire new grads, so that's why we put a lot of emphasis in our training, in our mentorship program to really get you guys to where you want to go. And I know it's like 7:50 or something right now, so I did want to touch on with the hygienists here. Can you talk about a little bit like what the room for growth is as a hygienist? Like becoming a lead hygienist, and then also like the opportunities that are non-clinical. Do you want to touch on that, Becky?
Sure. So Aspen has many great opportunities for their hygienists, and Aspen loves to promote from within, which is a huge thing with this company. And they don't have a lot of turnover. You're always going to kind of see the same people get familiar and get used to the same, clinicians, and really get to know them, which is really nice. We have a lot of offices, but it feels really small in that aspect. So you have a lot of opportunities. You can do be an associate hygienist, where you're kind of working with a lead hygienist and they're kind of directing more of the flow of the day and helping you with that. Then you can move up to a lead hygienist where you're in control of that business and of that office. From there, they have the non-clinical hygiene support roles, like being a hygiene manager, where your job is to really support a team of hygienists and to help them to grow their career goals and to really get to know Aspen and to provide the best patient care as well. So there's lots of opportunities. It's a really great company as far as growth, and it's a company that you can stay with for your whole career and really call it your dental home.
Mm-hmm. Chris, anything to add?
I mean, Becky pretty much gave you all the information on that. They really do like to hire from within. They see the potential in a lot of the employees there. And they like to kind of feed off of that potential and set you up for success too. So there's so many different opportunities out there for hygienists, just with their hygiene degree or their experience. There's so many different directions you can go with that, whether it be educating, management, anything along those lines.
Yeah, definitely. I know most of the territory hygiene managers in our company started out as hygienists. I think even the senior vice president of our company started out as a hygienist way back when. So definitely a lot of opportunities if that's what you're looking to do as a hygienist. If you don't want to be chairside anymore, if you do want to be chairside, you can become a lead, anything like that. So the opportunity is there for you. And I know as a doctor, Dr. Rayon, like you have the opportunity to become an owner. You can train other doctors. Yeah, so there are a lot of opportunities there as well. And like I said before, I think we'll take the last 5 minutes to kind of talk about how Aspen Dental has handled the COVID crisis and all of that, because that has been quite a few questions. So Dr. V, I think I'll have you start with this one. Have you had any shortage of PPE within your office throughout COVID?
So we have never had shortage. So the nice thing with Aspen is that there are 700 more than 700 offices nationwide. So we have access to supplies, and we can share between those offices. So it has not been difficult to get respirators, gowns, covers, any of that stuff. And as soon as we knew we were going to need it, it became available. So it's one of the benefits of working with a company and having the DSO there to worry about gaining those supplies. So I've never had to worry about that.
Mm-hmm. And what about you guys, Chris?
Never a shortage. Just like Dr. B said, there was one time where we were running low on some Cavicide, very important part of the practice. You need to be able to sterilize everything. So we just, send an email and a text to one of our neighboring offices. They had a couple extra in their inventory. We were able to pick those up to hold us over until our shipment came. So even if there is going to be a shortage, there's always those, you could always, use your other assets, whether it be another office to help you out in time of need.
And what about you, Becky?
Yeah, we've also never experienced a shortage. We've always been able to get what we need. On top of that, Aspen's been great about providing additional training videos for the whole office, as far as just, keeping everybody on board with what we're doing. We're taking temperatures, at the front. There's just a lot of different things that we're doing, as well as, my practice owner has been fantastic. Anything that we've needed beyond what Aspen supplies, he's gone above and beyond to really do that for me. And also, for me as a hygienist, I was nervous to go back, as I'm sure we all were. My hygiene managers, my doctor, they checked on me a lot in the beginning. How are you doing? Are you feeling okay with everything? And I really have to say kudos, because whatever I needed, they got it for me.
Yeah, I definitely think that it's been handled from a PPE perspective very well. I actually read, I think the other day, that Aspen Dental through Henry Schein was like the second largest purchaser of PPE in the country. And it was like second to the US government or something like that. It was kind of this crazy stat, but yeah, I know I've heard like you guys show up to work and the PPE is in, the storage closet or something like that. So it's definitely not something our clinicians have had to worry about. So what types of protocols and policies have now been put in place within your practice to help protect you guys as clinicians and also the patients in your offices? Dr. V, do you want to start again?
Yeah, so this is a totally different, environment than 6 months ago. So if you came into our office 6 months ago, we would look totally different, right? Temperatures are being checked on patients and employees, as soon as they walk in the door. We've got respirators that we've got on at all, hours that we're in there. So as soon as we set foot in the office, everyone's wearing masks. And, again, it goes for patients and employees. We've got, face shields, we've got gowns, we've got foot covers, head covers, humidifiers, things like that, just to, help reduce the spread of any of this, right? To reduce aerosols, to reduce, the likelihood of seeing someone that has this. So it's very different, but necessary.
What about you, Becky?
Yeah, similar to what Dr. Bayonne said, we're doing the same thing in our office as well. Also, just really, we have a patient questionnaire, making sure they haven't traveled outside of the country. And my front desk and my doctor as well have done a great job of screening patients. If they have a fever, then we do have to reschedule them, and it's never been a question. A lot of times I'll go, or sometimes I go up front and where's my patient? Oh, they had a fever. It's automatically done. It's just a standard that we have. Also at my particular office, we have a little bit smaller lobby, so that was a concern that I had with my owner doctor. So he actually purchased us like the restaurant pager system. So when we have a patient, the patients that are waiting, we give them the restaurant pager and they go out and they wait, and then we page them when they're ready. So we've gotten a little creative, but yeah, we're definitely trying to keep ourselves and our patients safe.
And what about you, Chris? Also, someone wrote in the Q&A, cute kid.
Oh, thank you. So pretty much what they were talking about, just all the right precautions, letting our patient know that we're taking those precautions, to putting their mind at ease. Very nerve-wracking time for everybody involved. So going to the dentist office, seeing temperatures being checked, everybody wearing masks, air purifiers, we're doing any aerosol procedures, and just seeing that we're taking all the right steps just to look at their safety and ours as well.
So what about, did any of your offices have to shut down? I know this really depended on the state as well and certain regulations that they had, but did you guys, Dr. Van, did you have to shut down your practice or?
Yeah. So we shut down for a bit. You know, as soon as things kind of escalated, you know, we made huge changes to the schedule, reduced the number of patients we were seeing. We were doing emergencies only because, you know, in the end, COVID comes around, but toothaches and, you know, infections in teeth are still there. So, you know, we had to be available to see these patients and see those emergencies. So we really, you know, we're pretty restrictive at the onset. And then we ended in our particular office for a couple months. Not that we were, you know, closing all Aspens, you know, we were still making ourselves available, but we were reducing the number of offices, at least in Arizona, that were open at one time.
Mm-hmm. And Chris, what about you?
Yeah, so well, once everything started to unfold, you know, they were keeping us well informed, but hygiene is considered an elective medical procedure. So once the word came down that, you know, they were going to postpone all elective medical procedures, you know, they kept us well informed. They did let us know, you know, a little bit beforehand to kind of prepare us. The timeline was always changing, so I was furloughed for 2 months, you know, but they kept us in constant contact, kept us updated about the timeline. So, you know, very fortunate that I was able to work for a DSO with, you know, all the communication that they had and support that they had during that time, because they understood just, you know, the reality of it all.
Yes, definitely. And Becky, what about you?
Yeah, I agree. I mean, the communication was great. Due to the, you know, the governor's orders, I did have to be furloughed. Aspen was great though. They actually transitioned their learning format into like something that we could log into at home. So I got all my CEs for my license during that time. I'm completely set, and it was free, so it saved me a lot of money.
Oh yeah.
So it was great, and we got, I mean, we got weekly messages from the CEO of our company, and honest messages telling us and letting us know what was going on. So the communication was top notch.
Mm-hmm. Yeah, I mean, unfortunately, like you said, multiple employees were furloughed during this time when, you know, offices were open for emergency procedures only. But you know, I think that was kind of the best thing you could do in a situation that nobody was really prepared for or saw coming. And I think Aspen really handled it in a way that we were able to bring these employees back. Which not every company in private practice was able to do. So I definitely think it was making the best of a situation that wasn't the most ideal. And then one more here, how did you feel that working for a DSO benefited you during like a time like this through a pandemic? So how do you feel that Aspen Dental Management provided support during a pandemic? Dr. Van, would you like to start?
Yeah. So, you know, again, when we're talking about a company that has 700 offices, you can share resources. And so that's not something that a smaller office can do. So, you know, Becky mentioned, you know, CE and things like that. So we eventually got to a point where, you know, there were other opportunities available, even though our offices were physically closed and, you know, the patients couldn't physically come to the office. We're doing things like virtual care and having doctors available there to see patients, doing things like CE. So, you know, although we couldn't physically be there, you know, we had I'll call it the luxury of, you know, continuing some, you know, operational capacity at home. So that's huge. And, you know, just seeing some of my colleagues and what their offices went through, how long they had to close, and, you know, some struggles they've had, it certainly makes you appreciate working for a DSO much more. You know, they do stay closed weeks, months. I know people that, you know, didn't open offices till June, and we were been and seeing patients. So, a lot of benefit to strengthen numbers through DSO.
Mm-hmm. And what about your office, Chris?
So I feel extremely fortunate that I was with Aspen while all this happened. didn't hope for it to happen, of course. Nobody would. Nobody expected it.
Yeah.
But just like we mentioned before, just the sheer support from Aspen, the CEO giving us personalized, very, important messages filled with information of what to expect, what they're working on, what they're putting in place so that we can return to work safely. I talked to a few other colleagues in my field, not as fortunate, whether it be private practice, different DSOs, just a lot of differences between what I was being exposed to at Aspen compared to what they were being exposed to, and then returning back to work, just having that full support again, making sure everything, was just going to run smoothly, and they didn't want no hiccups in the road, but they were just excited to get us back in the office.
And what about you, Becky?
Yeah, I mean, similar. I feel so fortunate to work for the organization. I have a lot of hygienist friends that unfortunately lost their jobs, or they came back to a 25%, pay cut temporarily. We've done nothing but grow since, we've come back. Chris and I have been, training new hygienists in our region. So, we're definitely hiring, and we have those opportunities as well. And if I can say, Aspen was fortunate because they are a larger organization. We were able to obtain that PPP loan, and they took care of us, during this time while we were at home. We did the online CE and helped in any way that we possibly could, but they wanted to make sure that we were able to pay our bills, and they did that.
Yeah, that's great. I definitely agree with all of those, and think that we were pretty taken care of from a company perspective, and definitely took care of our clinicians. I mean, that's who provides the care to our patients. So it's definitely a priority to make sure our clinicians are happy and taken care of from the Aspen Dental perspective. And it is a little bit after 8 o'clock here, so unless anyone has anything else they want to add into the Q&A, you can definitely do that right now, but I'm just going to ask one last question to each of our panelists here that I think would be pretty good to end on. What advice do you have for both student doctors and student hygienists graduating this year who are going to be looking for a job come graduation this year? Would you like to start, Becky?
Sure. I would say, do your research, really ask those questions, as I know hygienists are really good about asking those informed questions when they do interview with, potential employers. Really get to know the people and the company that you're working for. Support as a new hygienist, and any facet of your career as a hygienist is key. You really need that. And Aspen has provided that, and they really have thought of everything.
Chris, what about you?
So I'll kind of feed off of what Becky was saying. So honestly, I wish I started my career with Aspen, because they were always, on my mind. I always wanted to try my luck at Aspen, but they just set you up for success all around. Just the support, the way they treatment plan, the patients they see, the locations that they're at. Just everything about Aspen. I'm very fortunate that, I can continue my career growth there. And like Becky mentioned, if you have any questions, do your research. You could always ask, one of us as well, reach out to us. We'd be happy to help you out, because, we are all in on Aspen.
And Dr. B, what about you?
Yeah, so I would say start as a new grad, start looking early, right? So the earlier you start, the better you can situate yourself to what you're looking for. Don't be afraid to ask questions, because ultimately you've got to find something that is a good fit for you. So look early, ask questions, and be informed, on the companies that you're talking to.
Yeah, I mean, definitely do your research. You do have options, so you'll find what works best for you, whether it be Aspen, private practice, another DSO. They're all different types of opportunities, and the only way that you find what works best for you is to explore those options. I'm sure, like they said, every single person on this call would be happy to talk with you one-on-one and answer those questions to help you find that out. Get in, shadow an office, email me. I can put you in contact with any of these guys, and I think that's the best thing that you can do for yourself. And we did have one last minute question pop up in the Q&A for a hygienist, and it was, can you briefly touch on the training that hygienists get? Quickly, Chris, do you want to take this?
Absolutely. So the first week you're starting out learning the system. I mean, with any new company, learning the system is very key to your success. So you're going to learn the system. You're going to get all your logins. You're going to learn about all the support and where to access it. You start to learn a little bit about the scheduling. So like I mentioned, you are working with a lead hygienist who has been through the training and has trained other hygienists. For that second week, you start to utilize what you learned in the first week. So you slowly start to take over that lead hygienist schedule. They're there to kind of mentor you, shadow you, give you any advice you may need. So they're setting you up for success once you do start to take hold of your own schedule. So they cover every single aspect. I know my trainer at Aspen set me up for success right out of the gate.
Mm-hmm. Becky, did you have anything to add?
Yeah, like I had mentioned before, after those initial couple of weeks, you're also in contact. Aspen's great at, that effective communication. You're in contact with your hygiene manager. So anything you need, as well as your trainer, anything you need, they're always checking on you. How are you doing? What can I help you with? How can I support you? As well as, occasionally popping into the office to make sure that you're really set up for success. After those initial 2 weeks, a few months into it, when you got your your flow down, you're really feeling a little bit more comfortable as a clinician, then you'll go and do a couple more days of training where you'll learn the business of Aspen and how to be successful within Aspen.
Mm-hmm. Yeah, I mean, it's definitely a very guided process for both the doctors and the hygienists. Like, they don't just feed you to the sharks. You will learn, and they will definitely make sure you are prepared and comfortable in seeing patients. But it's a little bit after, I think it's like 8:13 right now, so we can go ahead and close this thing out. Thank you to everybody that logged in and joined us this evening. Huge thank you to our panelists. A little bit of a round of applause. You guys were incredible. I will definitely be following up with everybody and sending you guys an email. I will put you in contact with any of these clinicians. I'm sure they would be happy to answer any of your questions. So again, just let me know if you guys are interested, and I will also be sending out the link to the CE for everybody. But thank you all for joining, and I hope everybody has a great rest of your evening. All right. Bye, everybody.
Bye, everyone.
Good night.